We want to bring in another citizen question now. The topic is healthcare, and it comes from Dover.
Hi, I'm Ron Zink. What would you do if you personally did not have health insurance?
Mr. Coons, your response.
The question from Ron was, what would I do if I personally did not have health insurance? That's a tragic situation that far too many Americans and far too many Delawareans have found themselves in. I'd have to rely on the support of friends, of family, of people from our church, and probably the charity of the healthcare system. My wife and I had the opportunity recently to talk with someone at the breast cancer walk who's had exactly this tragic situation, who lost her job, lost her health, lost her marriage, and ultimately has had to go through 9 different operations in the last year. She lost her sister to breast cancer, and she is herself now struggling with breast cancer, and it's really only because of the charity of the Helen Graham Cancer Care Center that she's able to continue with her critically needed treatments and to care for her own children. That is a tragic situation for anyone to be in. And as she said to my wife tearfully, I'm not asking for a handout, I'm asking for dignity and for health care. One of the main reasons why I support the Affordable Care Act is it extends affordable, quality health care coverage to the millions of Americans who otherwise don't have access to quality health insurance.
I'm someone who does pay medical expenses out of my own pocket, so this is an issue that directly affects me, which is why I keep bringing up to both Republican and Democrats that somewhere along the line in this health care reform discussion, we've begun to confuse coverage with care. We need to make affordable health care accessible to the people in Delaware once again. Obamacare does not do that. We are promised health care costs would go down. The Congressional Budget Office just said they're going up. We are promised more people would be with coverage. The census just showed that since it passed, more people are without. We are not keeping our promises to the most vulnerable in our society. Instead, what I want to do is repeal that so that we can make way for real reform. That real reform will address care, allow the doctors to lower their costs, be able to negotiate with their patients, and have medical savings accounts so that people can save. By addressing care and the cost of insurance with portability and being able to buy policies across state lines, someone can have a medical savings account to pay for expenses out of their pocket and have a catastrophic only policy that is affordable for them.
I'm going to jump in on you for a second. So, I mean, some conditions require extremely expensive care, hundreds of thousands of dollars. What would people do in that kind of position?
Well, that's what I was just about to explain as I ran out of time. If we can make way for real reform that allows doctors to be able to prepare for the examination room, not practice defensive medicine preparing for the courtroom, they'll be able to lower their costs. So basic care will be affordable again. We'll have more preventative. Then consumers can also begin to save for such situations through medical savings accounts. Obamacare puts MSAs and HSAs in severe jeopardy. Then, if we also address the issue of portability and competition with health care insurance. Right now in Delaware we only have 3 options. If we can change the laws so that consumers can purchase a policy across state lines, we'll see the cost of health care insurance go down, and then a healthy person who just needs catastrophic coverage in case of an emergency or an accident can buy a policy that's usually about $100 to cover those things. So you'll be able to pay out of your pocket affordable preventative care and then have the protection you need if there is an unforeseen tragedy.
I want to give you a chance to respond in this.
Well, Ms. O'Donnell demonstrates again great skill and practice at simply repeating over and over things that are not true. Repeating them doesn't make them true. Her characterizations of the Affordable Care Act, of the connection between coverage of care, of the provisions of the Affordable Care Act are simply untrue. But I think we need to focus on moving this conversation forward. A critical provision of the Affordable Care Act is it does create multi-state compacts for cross-state insurance and for competition. It does also extend coverage, which is what finances and makes possible care. It provides a nationwide system of expanded family care, wellness, and preventive health care, which will ultimately both expand care and reduce costs. And it also preserves, I think, innovation, which is the biggest weapon that we've got moving forward to fight disease and to help promote American exports. I think it's critical that as we implement the Affordable Care Act, which is what I would do if elected to be the next senator from Delaware, that we manage costs, but we do focus on extending coverage as the best way to deliver high-quality care.